Welcome to On the Beat, everyone. I'm Troy Thompson. Joining me in the studio today is Dr. Johnston of the Gastroenterology Associates of Columbus. And everyone, talking about diarrhea. Welcome to the show, my friend.
Thank you.
You give me some great topics to talk about, don't you?
Well, this is what we do in the GI world.
This is what you do for part of your job. All right. How do you define the diarrhea issue?
Right. Well, I think it's important to establish that because diarrhea means different things to different people.
It does?
Yeah. I mean, people interpret things differently. So let's start off with what's normal. I tell people, whether it's constipation or diarrhea, normal can be 3 times a day to 3 times per week. Bowel movements, that is. So anything, if you're going 1 or 2, even 3 times a day, that can be considered normal. So anything more than 3, and so frequency is one way to define it, and then also the consistency of stool. Some people, it may be, kind of gross here, but pasty, watery. There's different ways.
Yeah,
but
more liquidy.
Yeah, exactly.
Okay. When does one see a provider if you seem to think you have an ongoing issue with diarrhea? Because you might just have diarrhea from something you eat.
Exactly, and I think that's the key thing.
I know if I eat something fatty and I'm not used to that, that causes issues.
Right, yeah, and everybody's bodies are different, respond differently to different foods. So certainly triggers like that may cause an episode or two. And there's lots of stomach bugs that can be transient too. People all the time get, an illness that strikes them for a day or two and their symptoms go away. So I think for unless it's a real severe acute episode, if it's just a little bit for a day or two, that's not something we would see that often. But when people come to see us, it's generally more prolonged issues.
Like a week?
Yeah, a week or more. Or if you see blood, or if you're having, numerous bowel movements per day, that's when you would want to see us, or maybe even have to, check into the ER or see your primary care provider.
What are some of the important causes or common issues?
So there's a lot of things that can cause diarrhea. I mean, the list is innumerable, or not innumerable, but it's lengthy. So some of the main things that we see, though, irritable bowel can cause diarrhea. Certain kinds of infections, obviously we just kind of touched on that, and some infections may be a little bit more persistent. C. diff or Clostridium difficile is something we see pretty commonly. I think we're going to devote a whole segment to that upcoming, so we won't get too deep in the woods on that. Certain medicines can cause diarrhea, and then things with our body, lactose intolerance, for instance. Some people don't realize that they're not able to digest lactose, which is the sugar in milk, and it sometimes can be as simple as eliminating dairy.
Is that what that is?
Yeah.
I didn't know that.
Well, generally people lose the ability to digest dairy as we get older. That's just the way we all are. Yeah. In some people it's a little bit more pronounced and symptomatic than in others, but generally that's how people are. When we can't break down the lactose, that gets kind of passed downstream through the gut. The bacteria in our intestinal tract break it down, and that can cause diarrhea, bloating, and such.
Okay.
Along those same lines, sugar substitutes and artificial sweeteners can also be the culprit sometimes. So,
interesting.
yeah.
So it's very, very important to think about what food you're eating and when you ate it, which could cause some form of diarrhea.
Right.
Do I come and see you if I'm having a diarrhea issue for more than a week, or do I see my GP and get referred?
Probably either one. It just sort of depends. People who are already established with us might call us initially. If they've not seen us, it can sometimes be a little bit harder to get in that quickly. So they might start with their primary care or urgent care, or even sometimes the emergency room if their symptoms are severe enough. And then that provider ought to be able to order kind of the initial round of testing, such as stool studies would be, sometimes warranted, and we can test for different kinds of infection.
Bacteria,
right, exactly.
And things like that.
And then if they find something that they can deal with, they may treat it. Sometimes they may go ahead and send to us, particularly if it's a persistent issue, because then we might start talking about having to do a colonoscopy or something like that.
Digging deeper, so to speak.
Yeah, because there's things like ulcerative colitis, Crohn's disease. There's even some class of conditions called microscopic colitis, which certain medicines can cause, and that would be something we would only be able to diagnose with a colonoscopy.
Okay, but treatments before we get to those colonoscopies, is charcoal? There's that conversation that you go and have a charcoal pill.
Maybe. I'm not so familiar with that one, but it sort of depends on what the issues are. So obviously if it's infectious, sometimes we'll treat with antibiotics. If it's something related to diet, we prescribe some dietary changes and have people review their diet. If it's things like ulcerative colitis or Crohn's disease, there's a whole different class of medicines for that. So it kind of depends.
Thank you. If you want to find out more information, there it all is up on the screen for you. Dr. Johnston of the Gastroenterology Associates of Columbus. Back after this short break.